Hi, today I'll be presenting the preliminary results of a qualitative systematic review concerning the effect working in academia has on researchers' mental health and well-being. Research conducted by those who work in academic institutions can lead to advancements in many areas of society, including areas such as healthcare, education, and disaster response. Considering the importance of academic research, it's concerning how little we understand about researchers' experiences of working in an academic setting and their perspectives on how working in academia has affected their mental health and well-being. What little research has been conducted so far in this area often focuses on very discrete aspects of mental health, well-being, or the researcher experience. Therefore, this systematic review and meta-synthesis aims to create an overview of how researchers experience working in academia and the effect these experiences have on their mental health and well-being through the identification of key themes across the current literature. This will be achieved by synthesizing existing qualitative data using reflexive thematic analysis. Reflexive thematic analysis is often used to explore questions pertaining to participants' experiences and is therefore well suited to address the aim of this review. We hope that the results of this review will deepen our understanding of this research topic and will aid in the identification of new or important avenues for further investigation. The eligibility criteria for inclusion in this review was as follows. Peer-reviewed research articles reported in English needed to have used recognized qualitative methods of data collection and analysis. Participants in the study needed to be clearly identified as working in a university or higher education institution and needed to be explicitly identified as researchers or explicitly associated with research-related activities, such as publishing papers, presenting at conferences, and applying for research-based funding. Whilst undergraduate students and master's students were excluded, PhD students were eligible for inclusion, as much of the research which explores the experiences of early career researchers has often included doctoral students within that paradigm. Finally, constructs related to mental health and well-being needed to be present in both the aim of the paper and form a significant part of the qualitative results output. This allowed us to gather meaningful data related to researchers' mental health and well-being experiences and enabled us to effectively address the aim of this review. 6 bibliographic databases were searched for relevant papers. We also conducted searches in Google Scholar and employed backwards and forward citation tracking on the original included papers. This allowed us to capture relevant literature not indexed in the bibliographic databases we had already searched, helping to elevate our search for evidence to a higher level of comprehensiveness. Studies were assessed for inclusion through a 2-stage screening process, which was conducted independently by 2 reviewers. A total of 26 papers were selected for inclusion in the review and were assessed on quality using the Critical Appraisal Skills Program Checklist, which is an instrument widely used for assessing the quality of qualitative studies. No paper was excluded from this review due to quality limitations, as the research topic is in its infancy, with limited literature published so far. However, we will report and consider these scores when writing up the results. Of the 26 papers included in the review, 5 studies included participants from North America, 13 studies included participants from Europe, 1 study included participants from China, and 9 studies included participants from Australia and New Zealand. The total number of participants recruited for each study ranged from 1 to 594, and the methods used for data collection included interviews, focus groups, surveys with open-ended questions, and autoethnographies. The researchers recruited as participants for these studies hailed from multiple disciplines and career stages. The findings of the preliminary analysis are highlighted here. 6 overarching themes were identified. The themes broadly reflected the following: the demanding and unstable nature of an academic career and its incompatibility with maintaining a work-life balance, the highly influential nature of both work and social relationships, the impact of working in academia on health, coping strategies and support, and finally the last theme highlighted a sense of privilege from being able to contribute to society, but also highlighted that those from underrepresented groups were disproportionately affected by the pressures of working in academia due to having unequal access to career opportunities and resources for support. Further research into the human cost that results from working in what can be a very competitive and output-driven academic workplace is needed, so that areas where more effective support can be implemented are highlighted. Thank you very much.